We have Debra McPherson, who is, of course, the president of the BC Nurses Union. She's also a member of the board of directors of Pacific Blue Cross during the 90s. And on the national stage, Debra has served as acting president of the Canadian Federation of Nurses Union, as well as 3 terms as secretary-treasurer.
Our democratic governments should serve the public interest. The fact that it is so obvious to us and to most voters now that they don't serve us perhaps explains why average people are frustrated with, and at worst, giving up on the public health services and other services provided through their governments. There's not a shred of evidence anywhere that counters what Canadians have had the privilege of experiencing over the past generation. Universal public health care, our Medicare model of care, is the most efficient, fair, and affordable method of providing care to all, regardless of income. And when I talk with my colleagues from the US, when I talk with my colleagues from Great Britain, from Australia, they all look at me and wonder that Canadians would even consider embracing any part of private model within our healthcare system. They just are shocked because of the problems that they've experienced. But here in BC, rather than invest in improvements to our system, and Lord knows we've had enough blue ribbon panels and inquiries to ask us what those might be, and certainly numbers of us in this room and in other rooms have posited reams of paper documents outlining real positive change that could be made in our healthcare system. The BC government has decided to cut services, close hospitals and long-term care facilities, putting individuals and communities in desperate circumstances. And all of us know of examples here. We lose St. Mary's, and the Royal Columbian is bursting at the seams. Failure to grow the Surrey Hospital, although many have been predicting for years that it needed to grow much more quickly than it has resulted in intense problems. We have a loss of our long-term care facilities and privatization of them, leading sadly now to real difficulties around access to those facilities. Sadly, our government and others around the world have moved away from enhancing the public service model with dedicated workers who are there to provide the service to a for-profit model of service delivery wherever possible, where profits and shareholders making profit drive the decision making.
There is one caveat, and you're going to be hearing this a lot from me in regard to capital projects in the years ahead. We're going to insist on one condition: that Partnerships BC take a hard look at how that project might be built as a public-private partnership.
Increasingly, we are seeing that this government's public relations exercise is based more often on marketing ploys and untruths rather than on evidence and real solutions. And you have only to look at that clock, that Medicare clock, which they've got on their website. You have to go there. It's an exciting adventure, really. But this Medicare clock is ticking away, all the dollars that are being spent on healthcare while you're on the website. And you can't come away from it without thinking that you're being crushed by a tsunami, which is exactly what they want you to think. You're gasping for air, going, oh my God. And then they say to you, and in 5 years, it'll be 70% of the provincial budget. Oh my God, what are we going to do? And it's this kind of hysteria making, which is, I think, scaring the public into accepting that maybe we have to have some privatization. If they were going to be honest with you, why don't they put on a clock that points out how much money is being spent per capita on healthcare in BC? Because that amount has not varied significantly over the past 10 years. It varies between, I think, about $2,600 and $3,000 a person. So, that's a less hysterical figure. Or if they really want to make us hysterical, why don't they put the Olympic clock, not the countdown to the Olympics, but the cost of the Olympics right next to it, so people can make a choice. Which clock do I want, the Rolex or the Timex? And that clock has a guard that we're paying for, by the way. So they are really exploiting people's fear about lack of access to healthcare, which I find the most morally distressing part of this, is the real lack of morality in the untruths that are being told. And it appears to have been designed, the conversation, from the outset to convince British Columbians that we just can't afford public health care, that private sector health care is the answer. And it's really interesting that, and I'm deviating from my notes because there's a new group out now leafleting at the conversation. And the new group is purporting to be private citizens concerned about choice in health care. And guess what? When you go to their website and look at their membership, guess who some of their funding members are? The coalitions for private clinics, for example. A bunch of liberal hacks who have run campaigns, been part of campaigns, assisted ministers. I mean, I think it's actually a front. And because it's just not going the way they want it to go. Because the public, quite frankly, isn't buying it.
I can tell you today that we're going to be making that a condition of provincially funded capital projects as over $20 million in the future. We know P3s save money, transfer risk, and add great value through design innovations and private sector ingenuity.
It's interesting as well that the model of transition of public services, which began with Thatcherism in the UK in the 80s, is the formula that many governments, including ours, are following. The private sector wants to get their hands on the enormous profit opportunities that exist in the provision of public services such as healthcare and education. And just like in Britain, in Canada, the intentional under-resourcing of health services creates a dissatisfaction and desperate public willing to accept anything in hopes of improving their access to the services they need. Now, you have noticed that they've switched from saying, from looking at the US as a comparator, because that is so blatantly underfunded and unequal that most people accept that it's just not a viable alternative. Then they went to the European model in a broader way of looking at things. Of course, they sort of didn't mention all the rest of the social supports that come with that European model. They just picked out health. They didn't talk about all the rest of the social services, housing, minimum wages, vacation retreats, access to alternative health care, all the other things that are part of the support systems in Europe. And now they're looking at a competition model as per the UK. So they're kind of shifting the model around to try and see which one will hook you in. And so far, Canadians just can't get hooked. The P3 model of healthcare in the UK, which is called the PFI, Private Finance Initiative, is far advanced, and it provides us with reams of evidence that P3s are, as was pointed out, more costly in the long run, result in lower quality healthcare, and remove healthcare services from the scrutiny of taxpayers and citizens, as the corporate interests involved hide behind their veils of confidentiality clauses to protect their business interests. And that's a really important thing, because what's really lost to you is your democratic right to have a say in how the healthcare system is operated. Corporations don't exist to make you happy. They don't exist to meet your needs, other than where it generates profit for them. The Disney Corporation CEO once said, "We have no obligation to produce art. We have an obligation to produce profit." And I think that that's the same for healthcare. And they've kind of sucked the life out of the American market. In fact, all of the scandal associated with absconding with funds and poor services has kind of tapped out that market. So now they're looking for markets elsewhere. Back in BC, Premier Campbell's proclamation in October that from now on in our province, every infrastructure project over $20 million must be considered as a possible P3 or they won't get provincial funding is shocking. Shocking when he's got a conversation going on about healthcare where he's adamant about saying there are no conclusions already made. And it's shocking when you look at the evidence. And Richard has certainly given you a great deal of information about the Surrey P3 and problems with P3s elsewhere.
Since we launched the Public-Private Partnership Initiative in 2002, we've actually either started or completed $4.7 billion in new P3 projects.